Bismillah ar-Rahman ar-Rahim. Good afternoon, everyone. I am Dr. Sayed Arifi, and on behalf of Health Academy, I would like to welcome you all to the webinar, a series of webinar that we are holding for especially you, our candidates, our trainees, our future graduates of the Dental Assistant Program of the Health Academy and the Saudi Commission of Health Specialties. It is a part of an effort to continue our engagement with you in these difficult times and keep up the pace, as hopefully also your morals, to study for this great profession and to serve this great country and do your part for the patient care and the community well-being as a whole for the country. Today's topic for the webinar is about the evolution of dental assisting profession. And for that, we have our distinguished speaker for today, Ms. Sana Masawa. She has great credentials when it comes to this dental profession. Ms. Sana graduated in 2001 as a diploma degree for dental assistant. And then she went on to graduate with a bachelor's degree in dental assistant at King Abdulaziz University, Jeddah. She has been in a number of positions in these years, including being clinical instructor with Ministry of Health in affiliation with German Catholic University. She has also been a basic life support instructor. She's already also a first aid instructor, as well as a BLS, basic life support instructor. She is also a certified item author at the Saudi Commission of Health Specialties. And currently, she's serving as a coordinator at King Abdulaziz University at the CPR Center of the dental hospital, as well as she has been a clinical instructor for the bachelor's degree program for dental assistant at King Abdulaziz University in Jeddah. We would like to welcome Ms. Sana Masawa and to take the board and proceed further with the session. Ms. Sana?
Hi. Thank you, Dr. Sayed, and thank you for the Health Academy to give me this opportunity to talk today about my topics. Thank you very much. So my name is Sana Msawa. I'm a specialist dental assistant, coordinator of UDS Center, CPR Center, clinical instructor in Faculty of Dentistry, King Abdulaziz University, Jeddah. The screen is shared already.
Yes, Ms.
My
Sana.
screen?
Screen is
Okay.
shared, but if you could do it also the slideshow so that the screen would be more visible, if you could, please.
Okay. Yes. It's slideshow now.
Yes, that is correct. Please go ahead. Thank you.
Okay. So today we'll talk about the evolution of dental assisting profession. In this topic, we will go through the introduction. We will looking back for the history of dental assistant profession, dental assistant scope of practice and responsibilities, dental assisting leadership, dental assisting workforce, innovation in dental assisting education, implication for dental assisting education, and future of dental assisting profession. As we know, Dental assistants are important members of the dental team as they are employed in every type of dental practice. The objective of this topic are to describe the dental assistant role in dental delivery system, to assess the educational structure of dental assisting profession, to impact the future role of dental assistant. When we go with the history of dental assisting, we're looking back. So we're evaluating where are currently with dental assisting education and practice today, it helps to look at where we have been. In 1856 to 1928, Dr. Kills employed the first dental assistant in his own dental office. By 1885, the lady of attendance, the first lady assistant who allowed the female patients to visit the dental clinic without complaining. In 1900, Dr. Kill employed or have chairside dental assistant and secretarial dental assistants both in his own clinic. So sooner, other dentists saw the value of dental assisting and began to train dental assisting in their own office. In 1930, dental assistant program curriculum was established. By 1848, the Certified Dental Assistant National Board was established. In 1950, 1 and 2 years program available for dental assistants. After that, the first book of dental assisting, the MDA, the Modern Dental Assistant, by 1976 was written by dental assistant for dental assistant. Now we'll talk about dental assistant scope of practice and responsibilities. The qualified dental assistant is a highly competent individual possessing skills and knowledge to perform the many tasks required to provide quality dental care. So we have chairside dental assistant and circulating assistant, expanded functions, dental infection prevention and control procedure, assisting in medical emergency, patient and community education, and administrative dental assistant. We will start with chairside and circulating assistant. The chairside dental assistant work primarily with dentists who use the four-handed dentistry technique. She mixes the dental materials, exchange the instrument by transfer the instrument to the dentist during the procedure, provide oral evacuations during dentist procedure. Important role for chairside dental assistant is to make patients comfortable and relaxed. Circulating dental assistant serve as an extra pair of hands where needed throughout clinical area, such as treating and dismissing the patient, preparing and caring of instrument and clinic. This is referred to six-handed dentistry. What about expanded functions dental assistant? The EFDA has received additional training to provide certain intraoral procedure under supervision of dentists. They provide work under direct supervision of doctors, and no irreversible procedure to hard or soft tissue are performed. The skills the expanded function dental assistant able to do, such as apply fissure sealant, fit the size of orthodontic bands, and suture removal. For infection prevention and control procedure, dental assisting managing the dental office infection prevention and control plan, following infection prevention and control protocol before patients come to the clinic, during the dental treatment, and after dental procedure. Dental treatment room disinfection. The administrative dental assistant, business assistant are primarily responsible for the smooth and efficient operations of the business office, like controlling appointment, communicating on the phone, coordinating financial arrangement. In medical emergency situations, the dental assistants have very important tools to recognize and manage the emergency situations. So the medical emergency is a condition that require immediate actions from the dental team. So all dental assistants should be certified as a basic life support provider, and dental assistants should routinely take and record the vital signs and update the medical records for each patient to prevent any medical emergency during the dental treatment. Patient and community education, by delivering patients personal oral hygiene instructions, delivering community dental health presentations, planning and setting up dental healthcare programs. Now we'll talk about the innovation in dental assisting education. From 1993 to 2010, dental assisting diploma. Dental assisting programs, diploma degree were offered in Ministry of Health College and universities. In 2008, private accredited programs are offered also. 2 to 3 academic years, followed by 3 to 6 months internship. From 2012 to 2017, the bachelor degree, the program established in King Abdulaziz University, Faculty of Dentistry, as the first program offered bachelor degree for dental assistant. They have 2 sections, bridging and bachelor degree. For bridging for the diploma student, they study 4 semesters followed by 6 months internship. For bachelor degree, they study for 6 semesters after the foundation year, followed by 9 months for internship. At 2018 to 2019, Dental Assistant Enhancement Program, it was in Ministry of Health and National Guard for non-registered dental assistants. Recently, we have dental assistant certificate offered from the Saudi Councils for Health Academy, 1 year, 4 blocks, 3 months for each block. This program is very condensed program, have 4 blocks. The first 3 blocks, it's combinations between lectures and training in clinic and lab. They have the 3 blocks. They have in the first block, fundamental of dental assisting, dental science and dental materials, patient management and preventions. In the block 2, they study radiology plus the clinical dental assistant 1, including the PROS 2, oral maxillofacial, RIS 2 and endo, plus communication skills and ethics. The last block, it will be for clinical dental assistant 2, pediatric, ortho and perio, plus medical emergency and compromised patient, management of compromised patient. The last 3 months for internship, it is actually, it will be clinical training in the different dental specialties. Now we talk about the dental assisting leadership. I am just the dental assistant, no longer applied today's to professional clinical assistants. Dental assistants require proficiency and knowledge in dental science and must have excellent communication skills. The most effective assistant also possesses leadership qualities in proficiency and knowledge, excellent in communication, recognizing team strength. So we'll talk about the proficiency and knowledge. As a part of clinical team, dental assistants are required to show the proficiency in variety of duties needed to gather diagnostic information for treatment planning and procedure, such as during dental treatment, dental assistants should be able to prepare the dental clinic, prepare all necessary materials and instruments for the procedure, transferring the instrument in proper way for the dentist, know the step of the procedures, know how she can manage with or dealing with dental radiograph and taking impressions material. Excellence in communications. An assistant with excellent communication skills should have the capability to recognize the various patients' communication styles. How we can know the patient style or our patient styles? By listening to the patients, know what the patients need. So by focusing in patients' needs and listening to the patients, we can recognize the style of patients and we can manage and deal with patients in better way. Recognizing team strength. It is important that dental assistants has a leadership role and understand the value and the role of each person included in the dental team. By working together in a harmonious environment, make a pleasing visit for everyone involved. Dental assisting workforce in Jeddah. When we make questionnaires for dental assistants and dentists work in the government sector in Jeddah, we found that approximately 628 dental assistants were employed in government sector in Jeddah. On other hand, we have 1,000 or about 1,143 dentists. So the ratio of dental assistant to the dentist, one dental assistant for 2 dentists. So we have shortage in dental assistant and we have demand in dental assistant career. When we see the number of dental assistant to the dentist, so we have a gap here and we have shortage in number of dental assistants in the government sector in Jeddah. Dental assisting educations. We have only 11% of dental assistants with bachelor degree. The majority of dental assistants have diploma, 80%. Now we'll talk about the future of dental assisting profession. So we have the factors influencing the future of dental assisting profession: large group practice, number of dentists, new treatment, and delegation of dental treatment to the dental assistant. Large group practice. The dental delivery system is undergoing a major restructuring with the rapid growth of large group practice. Many of these practices are employing more dental assistants per one dentist. More allied dental personnel, more delegating patient treatment to them. Number of dentists. The number of dental graduated is increasing, so the number of dentists per dental assistant is growing. As the number of dentists increase, the demand for dental assistant will increase. New treatment. Nowadays, more effective preventive methods are becoming available. Use silver diamine fluoride to stop the caries process. Management of dental caries with remineralization method rather than restoration. As this and other preventive treatments become available, dentists are likely to delegate these services to dental assistants. Management of dental care by using silver diamine fluoride. Delegation of dental treatment to dental assistant. Delegation of dental treatment to dental assistant allow the dentist to have more time to see other patients or more number of patients. Finally, the dental assisting profession is changing rapidly and the opportunities are endless. It is a time for dental assisting to make a difference in their profession, learn new skills, and attend continuing education programs to expand the knowledge edge of your experience. For all dental assistants, if you don't know where you are going, any road will take you there. Thank you. So if you have any questions, you can ask.
Thank you so much. Thank you so much, Ms. Sana.
for a great presentation. And definitely, as you have mentioned, it has been ongoing evolution, just like any other specialty, but specifically for dental assistant around the world, as well as especially in the Kingdom of Saudi Arabia. We will take questions now through the Q&A section. And we have already got some questions, and I will ask you, Ms. Sana, so that everyone can hear, and then you could respond to them as well. But before that, I would also like to add, which I forgot, and apologies for that, as because Ms. Sana, mashallah, has been doing so much in the field of dentistry and has a huge profile and credentials. I forgot to mention, and apologies for that, that she is also the scientific member or the member for the scientific committee for the dental assistant program that you all are studying right now. So thank you so much, Ms. Sana, for your contribution today, as well in the lectures, as well as your contribution in the curriculum that our students are studying right now. Thank you so much.
Thank you. Thank you for
it was a great presentation. So one of the first questions that the participants asked is about medical emergency conditions, and if they need any certificates, further certificates for the cardiac resuscitation and other procedures.
So we have already in our curriculum for dental assisting, we have medical emergency and medical compromised, management of medical compromised patients. So we'll go through how we can recognize the medical emergency, how we can deal with this emergency. We should call the emergency team immediately. So we'll go through all of medical emergency situation, inshallah. And the certifications, yes, we need the basic life support. It is essential to register in the program, and should be also to update or renewal after each 2 years.
Great, excellent. As well as they can go to do BLS and ACLS certificates from the Saudi Heart and American Heart Association.
Yes, yes, it should be. It is essential and mandatory course for all dental assistants. It should be, inshallah. They already take it before join our program, and they should make update or renewal the courses every 2 years.
Great, thank you so much for answering that question, Doc.
Okay, you're welcome.
The other question, one of the attendees, and I think is on the minds of all of our students, is your advice for the future dental assistants, and how can they improve their careers in different ways? One of the questions from the participant.
Okay, dental assisting career is a unique career. Dental assistants have a varieties of skills. She worked with the dentist, she worked with dealing with patients, dealing with the secretary, with the front desk employee, with the laboratory. She is a multitasker or multitasker career. So dental assisting can improve herself, or can improve the career or the profession by continuous educations, by attend the lectures, the conference in the interesting field for dental assisting, and by continuous educations also. Also, we have how we will be expanded function dental assisting by training, by job training, in job training. So dental assistant will go to the different specialties. She can improve her skills by training in the different procedures in different specialties. So it is multitasker career.
Great, thank you so much. And if I would add to that, you could also, while being, as Ms. Sana mentioned, being a great dental assistant, You could also be indulged in research prospects, if you like, in the profession and also in healthcare. What do you think, Ms. Sana? How does that, have you seen that in practice in your institutions that you have worked in when it comes to research?
The research, yes. We already have dental assistants with, they published the research in scientific journals. So it is, it will help the career to improve, inshallah, dental assistant profession to more improve.
Excellent. And I just would like to comment for all of our participants. Right now we have 336 participants online hearing us. First of all, thank you all for attending this webinar. To put it, I would like to remind you to put your questions in the Q&A section rather than in the chat, because we are taking all of the questions from the Q&A section. There's another question, Ms. Sana, that one of our participants interestingly asked, is there any center that the dental assistant can work without getting a license from the Saudi Commission?
I don't think. They should be registered dental assistant.
Yes, that is correct. And I would add to that comment, the Saudi Commission of Health Specialties and the Ministry of Health are very strict about all of the healthcare providers in any specialty who practice. They need to have a license, a formal license for that specialty from the Saudi Commission of Health Specialties before they can practice or touch any patient around the kingdom. In any center of any city in the kingdom, they have to abide by these rules. If in any case someone is seen or caught doing otherwise, they are subject to strict legal action and any correspondence according to that. So they will have to face those consequences. So therefore, for all of you as graduates of this program, you would be at the end of the 1 year given the opportunity to sit for the Saudi Commission of Health Specialties exam for dental assistant technician. And once you pass that exam, you would be eligible and you will be given the license to practice as a dental assistant technician. Hope we answered that question. So I'm just going through some of the questions as well. One of the questions was that you mentioned that there is a bachelor's program, Ms. Sana, in King Abdulaziz University. Is there a master's degree program for dental assistant in the kingdom? That was a specific question.
No, they don't have until now any master degree for dental assistant.
However, globally and in other countries we have. Is that correct, Doctor? Ms. Sana?
I don't know. They have, but not in dental assistant, maybe in oral health education, infection control. They can go through specialties. They can help in dental assistant profession.
That is correct. And then, and if I may add, for those specialties that Ms. Sana just mentioned, you can also do public health,
Yes.
Master's of Public Health. And one of our scientific committee members and the director for program director for King Abdulaziz University, Dr. Manal Shamlan, also added public health as a master's that you can do. That is correct. So we are still open to answer any of your questions regarding the dental assistant. So please go ahead. We still have time, luckily, to answer these questions. One of the questions that they have asked is there any way for them to learn more skills to be an expanded assistant dental or expanded function dental assistant, as in the courses other than practicing in the clinic?
Yes, if they have a passion to be expanded function dental assistant, they can attend the clinical courses. We have hands-on courses in the conference or in the universities. So they can attend the hands-on clinical courses and improve the clinical skills.
That's correct. One of the other questions, and thank you so much for answering that. One of the other questions that one of the participants asked is that if they can work in surgery rooms for oral and maxillofacial surgeries without having any extra special certificate.
Yes, they can work in oral maxillofacial dental clinic by training, take extra training in this field, and they can go to the OR by taking also extra training in this in the OR, the operating room, I mean.
Thank you so much for answering that question. One of the other questions that our participants asked is if this program that they're taking, the dental assistant program, is a diploma program or is considered just a program. I would like to answer that on behalf of the Academy. This program is considered as a certificate, professional certificate program. This is a one-year program, as Ms. Sena discussed, thankfully, in the presentation, that historically we had 2-year programs or 3 years diploma programs. And after that, the participants were, or the graduates, were credentialed as dental assistant technicians. However, all of you being graduates of science, you have given the advantage to take this 1-year program rather than 2 or 3 years program, and take this 1-year certificate program and get credentialed equally as a technician like other diploma holder programs. I hope I answer your question. One of the questions just now we got from Ms. Nadia Farag, one of our participants, is for you, Ms. Sena, that is there a society for dental assistants?
Before, in 2005, we have Dental Assistants Club, Dental Assistant and Dental Hygienist Club. I was a board member in this club. We have we also established dental assistant training program. For 2 years, then it stopped until now. So inshallah, we will try to do this again, to establish again dental assistant society or club, scientific club.
Great, thank you so much. Yes, and we encourage all of you, the future dental assistants, to surely have a society and club and have more interaction and have more collaboration amongst yourselves for your betterment of your future, to take the agenda of dentistry and dental assistants forward in the kingdom and in the communities. So we would highly encourage that as well. That's correct, Ms. Sena.
Yes.
One of the other questions is that, is there a special conference for dental assistants in Saudi Arabia to be held to see their roles in dentistry?
Yes, for 2 years, 2 years ago, we already have Dental Assistant Symposium in Saudi International Dental Conference in Riyadh. I was one of the speakers there. We have a lot of dental assistant sessions and hands-on workshop. It was very great dental assistant sessions, and inshallah every year the Saudi International Dental Conference at Riyadh will hold dental assistant symposium special for dental assistants.
Excellent.
Great. King Saud University with the Saudi Dental Society.
That is something that all of our graduates can look forward to.
Yes.
And what time of the year usually this conference happens, Ms. Sena? Is there
in January.
So we would expect in the coming January that we have
they have dental assistant symposium, inshallah, in coming January, inshallah.
Excellent. That is great.
Also in EDIC in Dubai, they also have dental assistant sessions.
Excellent.
Last year, yes, in February.
Excellent.
So we have national and international dental assistant symposium.
Excellent. There's another question, and there, I think, a couple of questions on similar. That is it. Would it be a good idea to have a healthcare quality diploma or infection control diploma after completing the certificate program to have future aspects?
Yes, it is a very great experience for dental assistant to be certified in quality or infection control. It will help the dental assistant profession to improve in different type of dental procedures.
Excellent. One of the other questions asked is about, are we allowed, once we get a license, are we allowed to work as private, in private, I think, dental clinics? That is the, so I would like to answer that. All of you, mashallah, all of you, when you graduate, you would have, already you have, as we speak, signed contracts, pre-employment contracts. We call them conditional employment contracts, to work as dental assistants once you graduate and attain the license from the Saudi Commission of Health Specialties. Therefore, you should professionally and ethically join the employer that has guaranteed your place in employment. However, once you have completed those contracts and completed the duration of those contracts, then you are free to work in any private or public sector as a dental assistant. I hope I answered that question. One of the other questions that they ask is there a research center for dental research and dental assistant research or dentistry related research in the kingdom, as the participant has also education in genetics, so he or she would like to apply that?
Okay, I think in each center or university, they have a research center, so they can contact the research center to start the research. So they can contact the research center in the university or in the training center. So I think they have already.
Excellent. Yes, that is correct. Many of the major universities around the kingdom have research centers, and part of those research centers is the healthcare research, and dentistry is one of the important parts of that healthcare research that the universities are doing at the moment. One of a very good question that I saw just now, one of the participants asked anonymously, is I think applicable for all of the 338 participants that are right now listening to you, Ms. Sana.
Yes.
Your advice on for this time, how they can utilize this time that is difficult for all of us, working from home and studying from home. And now, as you know, our program has been temporarily suspended because we need to continue the block to physically for the practical sessions. And therefore, your advice they want to seek on having any current online courses for dental assistant and how they can improve their skills, where can they find such courses, and so on.
So they can register in American Dental Association. They have online courses for dental assistant, very interesting online courses in different specialty. So they can first register and be a member in ADA, Dental Assistant Association. Then they can register on the online courses.
Excellent. That is great. So American Dental Association online, do they have any fee?
Online courses for dental assistant. Yes, they have.
Is there any charges for that, Ms. Sana?
Yes.
that they have to pay?
Yes.
What is the usual amount for them
Uh,
to know?
I don't know.
Okay, so we will have to
Yeah.
find out. That is okay. I don't know either, but they'll have to find out by going
But
to.
they should be a member first, then they can join the online courses.
Excellent. And I would like to add to that. So this is specifically for dental assistants. However, you have a lot of free online courses for your personal and professional development when it comes to, for example, soft skills, communication skills. Durub is one of them. Udemy has a lot of free courses. LinkedIn also has a lot of online free courses. And there are right now many other institutions. Harvard Medical School has many courses of soft skills that you could improve your professional as well as personal skills that apply professionally in any of the specialties, let alone dental assistant. So definitely you could add to it. One of the questions is related to research. She asks if it's okay to participate in any research topics regarding major ideas that we are required to work in.
Can you repeat the question, please?
So basically, what I understand from the question is it okay to work on any research topics which are included in dental assistant program and we are required to work on it? So is that okay professionally?
Yes, they can do the research related to the dental. I cannot understand the question.
So I think what they mean, and I will try to also answer it, is as you understood correctly, Ms. Sana, that the question is basically about if they are allowed to work on any topic that is included in the dental assistant program, and they can take it as a research topic. Yeah, well, that is the ideal situation. Yes.
It depends on the training center.
Yes.
So they should go to take the ethical approval from the research center. Then they can go through the process of the research.
Great. And then also, it's always ideal on whatever you're studying, you can definitely, or your area of specialty, you can definitely have a focused research topic based on that specialty. And definitely that will do good for your specialty and for yourself and your professional development. A very interesting question also that I went through is about accreditation and JCIA standards, and if there is any specific JCIA standard related to dental assistant, or is it only general?
Okay, the GCA standard will accredit the place or the center or the hospital as the hospital or the center. What about the employee? They should be qualified and should be registered with the Saudi Council. This is what should be with the employee.
Yes, and if I would like to add also, as long as the Joint Commission International Accreditation, JCIA, is concerned, there's no very specific standard of dental assistant. However, when the accreditation when a hospital goes through accreditation, they have to go through all of the specialties, all of the departments, dentistry being one, have to go through all of the standards of quality and patient measures and all that. And of course, we as dental assistants take part in that accreditation and making sure all of the quality standards are applicable.
And should be registered or licensed as registered dental assistant.
Yes, that is correct.
Licensed from the Saudi Council. Yes.
That is correct. So they check the licenses of all of the healthcare professionals working in the hospital, that they are correctly licensed from the right authorities, and in Saudi Arabia, that being the Saudi Commission of Health Specialties, so they have to have that license. Otherwise, all of the other standards are applicable
just like any other department of quality, infection control, international patient safety goals, etc., etc. So I hope we answered your question about the accreditation. There's another question about, again, the roles, what else that they can do, or how they can expand their roles when it comes to dental assistant. I think Ms. Sana was very elaborate in answering that question. Do we have any other questions regarding the Q&A? I'm looking at the Q&A, the Q&A section. There's another question, I think, related to the JCI, where it's detailed competency tests for DAs. There was another question about Block 2 exam. That's a good question. So I would like to answer that. So the Block 2 exam, or Block 2 in general, so we have, as we mentioned earlier, that we have temporarily suspended the program due to the COVID situation right now, as well as the nature of our program, which is to have practical sessions for you to practice, as well as your evaluations in those practical sessions. Therefore, we have completed the theoretical part. Most of the learning objectives theoretically could be covered through those lectures that you have received through Zoom or iHeat. And now, once the situation gets normal and we are allowed to go back in physically, then we will resume the program, and we will resume with the practical sessions. I believe we have around 6 weeks left for the practical sessions. And after that, once we continue and start with the practical sessions and complete those learning objectives, practical learning objectives, once we have done that, then we will have the exam for the second block. So if specifically you'd ask for a date from us, we are unable to tell you right now due to the situation. However, once we resume, it should be by the 7th week when we resume. From the day when we resume, it should be by the 7th week that we will have our exams scheduled for the second block. I hope that I answered the question. Great. So I'm looking also again to the questions. One of the questions, mashallah, we have a lot of questions and very inquisitive participants today, which is very encouraging for us panelists. It's very encouraging, and because we have time, we will definitely we can take a few more questions. One of the questions that Ms. Maha, our participants asked, one of the participants asked is, can the dental assistant give the patient anesthesia after this program at dental office?
For local anesthesia, dental assistant is not allowed to give local anesthesia, just topical anesthesia under supervision of doctor.
That is correct. And then to complete it or to comment further, it's out of boundaries to give any general anesthesia for the dental assistant. We have anesthesiologists for that when it comes to OR rooms or operation theaters and so on. So as Ms. Sana said, only topical anesthesia when it comes to dental office. I'm just going through more questions. There is one more question about if dental student can take practicals where they live. So I think this is one of the questions that was asked before as well earlier, is about the internship of the program. The internship program, the internship, the last block or the block 4 of the program is internship. However, all the students need to understand that the internship, as well as all the other blocks, are part of the 1-year program in the training center that you're studying. And therefore, you have to take the internship in the same training center. We will not be able to allow you to take your internship in any other training center but yours, because of the fact that you have studied in that center and it is a part of, integrated part of the program within. And therefore, you have to complete the internship in the training center that you are being trained. I hope that is very clear for everyone. One of a very interesting question that one of our attendees has asked is, how can they preserve their rights as dental assistants? Ms. Sana, if you'd like to shed your knowledge. They're talking about rights and how they can protect their rights being dental assistant in general.
The right of dental assistant, like the right of any medical employee, so they can go to the rights of the hospital or of the center. They have the rights of employee, say they can go through the employee rights.
Great. Yes, that is correct.
Regarding to the hospital or regarding to the training center?
Yes, that is correct. It is, we have equal rights just as any other specialty when it comes to healthcare providers, and their rights and responsibilities protected by the labor laws as well as by the government, and therefore you have equal rights when it comes to it. One of the other very interesting questions is, and very good, is that once I have the license, would I be when the time comes for renewal of the license, would I need CME hours just like any other specialty?
So they ask about how
CME hours.
The CME
and the
hours?
renewal of license and renewal
Yes.
of license.
All healthcare providers should renew or re-register the certifications of the Saudi Council or the registration of the Saudi Council by attend the conference, CME conference and courses. So they have maybe from 40 to 60, it depends on the specialty. For 2 years, they will count the numbers of the CMEs. If they pass all the CMEs or collect all CMEs, they can re-register.
Yes, that is very correct. It is very important for all of you, once you have attained your license as dental assistant, that you keep on your study by attending different trainees, and it can be around the kingdom. And this is part of the effort of Saudi Commission of Health Specialties to make sure that all of the professionals, healthcare professionals, are encouraged to keep up their knowledge, keep their knowledge up to date, in other words. And therefore, this is why we call them continuous medical education hours or credits, meaning that once you have the license, you need to attend several training sessions that are accredited by Saudi Commission to show that you have been up to date with the current knowledge. As we all know and appreciate that healthcare specifically, and true for all the other industries in the world, is evolving, and today's topic was evolution, is evolving in so many aspects that all of the healthcare professionals need to be up to date with the current research and current facts, findings of research, and therefore the CME, the continuous medical education, is very important for you as an aspect of your professional development, as well as a requirement for licensing, renewal of your license. You have to show your evidence that you have gone through this continuous medical education and you have been updating yourself, and therefore you are eligible to renew and practice further. So this is very important point. Thank you so much, Ms. Sana, for also highlighting the importance of it.
Okay, you are welcome, Doctor. Thank you for you. Thank you for all.
One of the things that I would like to remind you, we have taken as many questions as possible. We would like to please request all of you, all of the participants today, that once we conclude this session, you will receive a link for a survey. We would like to hear from you through this survey. This is the only way in webinars we reach out to you and we hear from you. Your feedback about today's session, as well as your feedback on what else would you like to have more in these webinar series for your engagement. So we please take your time. It will take a few minutes of your time, of your invaluable time, to take the survey. We encourage all of the participants to please take the survey so that we can hear your voice through those surveys and plan accordingly the coming webinars for your engagement and for your better development professionally in this difficult times, inshallah. I would like to thank Ms. Sana again for your great presentation and an engaged session. Thank you so much. Allah ya'tik al-afiyah. We really enjoyed it. Thank you so much.
Thank you, Doctor. Allah ya'tikum al-afiyah. Thank you for all.
Thank you so much, all of the attendees who attended today's lecture. And we will, inshallah, continue this effort and have webinar series in the coming days, inshallah, to enlighten you all more about your role as well as your future, inshallah, that is very bright with this field. And inshallah, we are hoping everyone the best, as well as I would like to congratulate all of you for Ramadan, which is just around the corner. May Allah bless all of us with the greatness and the great blessings of Ramadan. And inshallah, we'll see you soon in the next webinar, inshallah, in the coming days. Thank you so much. And please don't forget to take your survey. Thank you so much, Ms. Sana. And we will conclude this.
Okay.
Thank you so much. Really appreciate it.
Okay. Thank you very much. Okay. Thank you.
Thank you. Have a nice day, everyone.